Hi, I'm Selena Campbell, a frequent host of the podcast This is Infertility for Progeny, a leading fertility benefits management company. The rule of thumb for infertility is that if a male-female couple has been trying to have a baby for a year without any success, then it's time to see a fertility doctor. And if the female in that couple is 35 or older, then they should seek treatment after 6 months. But for many, taking that step, seeking that treatment, and starting that conversation can be quite intimidating. But it doesn't have to be. We previously did a video on the initial consultation visit. And today, we're going to speak with a reproductive endocrinologist on why this visit is not something you should be afraid of. And we're doing so with the help of an expert, Dr. Michael Homer from Reproductive Science Center in the Bay Area. Before we dive in, I just ask that you subscribe and like this video, because doing that helps others to find it. The initial consultation, also called the initial evaluation or the fertility evaluation, is really more or less a normal doctor's appointment with some specific tests thrown in.
It's not unlike any other visit that you have with any other doctor, really. It consists mostly of the first and most of it is just talking. So a matter of, just getting to know you, who you are as a person, what your goals are, and what you've been through. Also then, of course, to talk about your history, whether it's fertility or, GYN or just normal history and surgery and all of that. Laboratory work or any imaging or workup you've had before. In that initial consultation, we're usually trying to sort of figure out, what has been done so far, and what next steps need to be taken. Part of initial consultation will always be doing a physical exam. And so typically it basically just involves an ultrasound. And an ultrasound is where it's very important for us to be able to look at the uterus and the ovaries and anything else that might be pertinent in order to help, learn a little bit more about you.
The initial consultation is a wonderful opportunity for you to get a baseline understanding of your reproductive health. Sometimes something very clear and straightforward can be identified. And regardless of what comes up during the initial consultation, this is also a great opportunity to start discussing next steps.
Typically, in an initial consultation, we're also going to talk to you a little bit about treatment options. Now, sometimes we know what treatment options might be available for you, it might be best. And other times, we need to get more information. And so more information consists of a couple of different things. One is usually blood work to look at various things like just overall your general health and your thyroid, vitamin D status. It could also be looked at ovarian reserve, which can be important for fertility treatments. Also, we'll be needing to get sometimes some imaging studies, whether we're going to test to make sure that your tubes are open or further testing more than the basic ultrasound to make sure we can look at the uterus in a more fine detail.
The bottom line is that the initial consultation is not something to be afraid of. The point of this first visit isn't to kick off treatment, and it isn't a gateway directly to the most expensive and invasive treatment. The initial consultation is just that. It's a consultation.
Fertility consultation is educational. It does not mean that you have to do therapy. It just means that you need to know more, right? So if you're thinking about coming to go see a fertility specialist, it's usually because there's a question on your mind that Google doesn't answer, right? And that's why we're here. And so if you're able to come into our clinic, it's really just to learn. And our goal, the fertility treatment part costs time and it costs emotion and it's effort. And our goal is to let you know what, the chance of success is going to be, whether you need to seek treatment or not, or at least just to give you the basic amount of information that you can do to make the best decision for yourself. So if you and your partner have questions about your fertility or you're having issues or struggles, it never ever hurts to just go talk to someone to learn more information or at least to help guide you through to what the next steps might be for you and your partner to grow your family.
This visit is crucial, especially for those who've been trying for a while now. The information you can glean from this visit can really guide you going forward and maximize your potential to reach success sooner. If you want to dive in a bit deeper into all things fertility and fertility health, you can find articles and other materials at progeny.com/education. And if you want to hear some stories from others who have been through fertility treatments, you can find those on our podcast, This is Infertility. Thank you for watching, and don't forget to like and subscribe.